Thank you very much. I'm really honored for the opportunity to speak here on this panel, and I just want to piggyback on what my two co-panelists have said and share my thoughts. I want to be very clear, even though I am a physician and the Chief Medical Officer for AARP Services, which is the products and service arm of AARP, I am wearing 100% the hat of the consumer, so everything I say is going to be through the eyes of the consumer. So I've listened very carefully yesterday morning. I couldn't be there all day yesterday, and listened very carefully today. And I would say after hearing such a phenomenal presentation, and thank you to all of you who put this workshop together because of an extraordinary learning experience for me. But when I sit back and I think about the takeaways from this, I'm looking at it through the lens of Chief Medical Officer of AARP Services. We service 37 million members across this country, have the largest circulating magazine in the entire country. We have products and services that we offer to the 50 plus that come close to $1 billion a year. And my job, very small, is to improve the experience of care for the 50 plus. Small job. The second role I have is I'm an emergency physician. So when I hear about the alerts and prepare, I mean, my life was centered around preparedness, alerts, responding to emergencies. And more importantly, when you work in the emergency department, you see what happens through the failure of communication, the miscommunication that subtleties of hearing loss can bring, and the challenge as a physician of trying to communicate in a busy, loud, noisy emergency department of what kind of instructions for care and follow-up care. And then finally, it's very personal because of my father, who spent 15 years with progressive hearing loss, just the classic insidious hearing loss, didn't think he needed. He spent $200 here, $200 there for every assistive device, but no, I don't need hearing aids. And finally, he got his hearing aids, and all of a sudden, he wasn't shuffling, he was walking with confidence. All of a sudden, he wasn't bent over, but he was animated. He was telling jokes. He wasn't sitting quietly in the corner. He was part of the family, and he was telling jokes, laughing, enjoying his children and grandchildren in a way I hadn't seen since I was a child. So I have a lot, as you can tell, a lot of really personal thoughts and passion that this vision of what we can do with hearing and hearing loss could bring. So as I think about this, I have one major takeaway with three messages underneath it. So my major takeaway for all of us who are involved, whether you're the audiologist, the patient, the doctors, the primary care, the public health specialist, the researcher, is we have to change the conversation. Okay? We need to change the conversation because it is about the consumer and consumer engagement. The rest of healthcare is already pursuing consumer engagement, behavior change, motivation, et cetera. I think it's also time for the hearing community to also face that. And what we really want to do is change that conversation, not only about what hearing loss is and means to the average consumer, but also what we're demanding of the industry and what we're demanding of research, so as consumers we can get the change we're asking for. So when I talk about changing the conversation, there are three components, and I'll talk about each one. The first is changing the conversation so it's about the heart and mind of the consumer, the person. The second change is we have to talk about it as a continuum, not an on-off switch you can hear or not hear. And the third change is affordability, and not just in money, but in time, effort, and convenience. So let me go back to the hearts and minds. Consumer retail does it really well, right? How many of us always want that new fancy shoe, that better car, the faster car, the better car? Because consumer retail knows how to grab at the hearts and minds. So if we want to follow that and have the hearing tests and have people be tested and understand the importance of hearing, we can't talk about it as a hearing loss, but it's more about what you gain from social interactions, social family connections, productivity at work. It's about gain, it's not about loss. It's not about hearing loss, it's about lifestyle and how you can live better. It's not a standalone disability, but it is integral to everything we do every single day. Because that's what I hear and what I heard is how important hearing is to that component. And why do I think we haven't tapped into that optimism and tapped into the people we're trying to care for? Well, we did a study. One of the things we have is AARP branded Medicare supplemental health plan. So several years ago, I asked, can we do a study and just take a look at quality of life issues? It's not just about health, but it's about quality of life. Well, it turns out that hearing loss has a greater impact on your quality of life than diabetes, heart disease, coronary artery disease, hypertension, any other medical condition. Hearing loss has a greater impact on quality of life. But it's like you say, medical students, we don't talk about quality of life. And what's fascinating to me is, we have all the airwaves are covered with diabetes, obesity. That's like 30% of the population. But 2/3 have hearing impairment. Wait, what's the disconnect? Why isn't it hitting the airwaves? Secondly, AARP, in conjunction with the American Speech, Language, and Hearing Association, did a survey in 2011 of the 50-plus population to get some attitudes about hearing and hearing loss. So what I thought was really fascinating is 85%, okay, imagine if Congress ever had an 85% rating, but 85% said that hearing was very, very important to their quality of life. More importantly, 76% said it's personally important to me in my life. And 68%, well over 50, 2/3, said we aren't paying enough attention to hearing loss as an important healthcare concern. So you've got a population that's ready, willing, and wants to talk about it, but we're not capturing that. And instead, what do we have? You heard the numbers, only 43% have actually said they've had a hearing test. What I think is really fascinating is 88% in the last 5 years have had vision tests. 71% have had flu shots. But 58% more people have had colonoscopies than hearing tests. Well, what's wrong with this prevention message, if you think about it? The other interesting thing is we hear a lot about it's a stigma. No, people don't want to, have hearing aids. Well, I think it's time to blow that myth away because, again, in our survey, it shows that 64%, again, almost 2/3, said they didn't think that hearing loss meant hearing aids meant you were getting old. 66, again, 2/3 of them said it really didn't matter. They disagreed that they didn't want other people to know about it. And 71% didn't worry about whether other people saw them with a hearing aid. So the paradigms are shifting, and we need to be there. But what they did say is what would make them get a hearing test or do something about their hearing? 68% would say if it was hurting the relationship with my family. 59% said if it's a burden on my family, if I were to become a burden. Now we know from AARP research, what are the two most important, the top three things that are on people's minds? They care about connectivity, relationship with others. When you're 100 years old and you're ready to kick the bucket, that's what matters the most. The second is you don't want to be a burden on your family. And the third, they really care about your brain fitness and alertness and stimulation to the brain. So it seems to me that you are in a wonderful opportunity where there's a recognition that we want to have a good life, and it's time for what's next in our life and what's possible. The hearing community is in a wonderful place to begin to say, you know what, it's not about loss, it's about gain. So that's my first message, is we have to change how we talk. It's an upbeat, it's not a negative thing. The second piece of the conversation is it's a continuum. We seem to talk about you either have hearing loss or you don't have hearing loss. You need a hearing aid, you don't need a hearing. You need an assistive device, you don't. But I think what I heard and what really resonated with me is it's also a continuum of acceptance. So shouldn't we be talking about where you are on the stage of acceptance and what are the products and capabilities and how do we help people adjust and move through that continuum? Isn't it also about a continuum of the kind of devices that are out there depending on what circumstance you're in or what your personal values or how you live? So we need to be talking about hearing as a lifestyle and across the continuum of not only your actual hearing loss, but where you are in your life, in your stage of life, and the activities that you do. It's about behavior change. It's about motivational interviewing. It's about patient activation, readiness to change. Those are things that we're talking about in healthcare. We should be talking about that in hearing loss as well. And the last category of changing the conversation to me is affordability. Yes, we can talk about the money. It's coverage, it's reimbursement, it's, whether, it gets paid for by others. But I want to say it's not just about money. It also resonates for me. It's respect for the time and convenience of the consumer. if you have to go back multiple times for constant readjustment, what are we doing with the technology to make it easier so you can do it from your home? My father, once he got his hearing aids, every time he needed to go for adjustment, which was pretty frequent in those first 2 days, first several weeks, it was 2 bus rides, 2 hours to get to the audiologist, and he lives in a major metropolitan city of Pittsburgh. Okay? You've got to think about that time, the convenience, the conversations, how can you make it self-adjusting, how do you test yourself, how can you do some of this self-care and self-work to make it easier. And the other form of affordability is that not just time and not just money, but it's also that effort of hearing. I heard loud and clear when there's lots of noise, how you can't have a conversation, et cetera. So what can we do to reduce the effort, to improve the time management, as well as to improve the dollar part? If we can get the research to do this, we can do the health policy changes to do this. I think we can bring in the consumers to help move the industry. So what I like to say is this is the baby boomer generation. The baby boomers are coming. I thought it was also really interesting in the AARP survey that 70% of people who said they had excellent hearing, this is 50 and older, also thought they were younger than their stated age. Now, can you talk about a motivator for the baby boomers? We're the ones who brought civil rights. We put a man on the moon. We had rock and roll, which is why we have hearing loss. We had rock and roll, and we brought Woodstock. So if this isn't a generation that can bring about that change, I don't know what else is. So I think we can do it.